Even animals such as deer, elk, magpies, hedgehogs, and others eat Fly Agaric mushrooms, as they help them fight viruses and boost their immunity. Micro-dosing Fly Agaric is the consumption of small amounts of the mushroom over the course of a therapeutic treatment. This method of using the red Fly Agaric mushroom opens up the widest possible medicinal possibilities for this fungus, both for the body and the soul. Fly Agaric microdosing shows high effectiveness in unlocking one's resources, providing more strength and energy, improving mood, and reducing excessive fixation on negativity. A healthy optimism arises, and there is generally more common sense in the perception of reality, with improved attention and concentration. Fly Agaric amazingly enhances motivation and interest in life, helping to cope with laziness. It also normalizes sleep, making it easier to fall asleep, and many people start having vivid and colorful dreams. Awakening becomes easier, and less time is required for a warm-up. Fly Agaric is a powerful natural antidepressant. And there are many cases where people have successfully weaned off chemical antidepressants and cured depression through microdosing. It also effectively treats depression caused by withdrawal syndromes, tobacco, alcohol, drugs. It stabilizes mood, making it even and optimistic, but without euphoria. Practice shows that the optimal amount of Fly Agaric for microdosing is 0.2 to 1 gram per day. The amount is chosen individually through empirical trials. There is not a single drug in world practice that gives 33% complete rejection of alcohol. Micro-dosing of Muscaria had an impact on the reduction of alcohol consumption in 85% of cases to varying degrees. Even if you split it in half, for the most critical, it's still impressive. In this video we will inform how Fly Agaric microdosing helps to reduce or reject alcohol and heavy drugs using with alcohol addiction. The mind and body become addicted to alcohol. High tolerance for alcohol, difficulty in identifying one's own intoxication, and regular drinking increase the risk of addiction. Severe alcohol withdrawal symptoms are almost always a sign of alcoholism. This is chronic, that is, long-term or recurring, and often slowly developing disease state in which the mind and body become dependent on alcohol. The symptoms of a hangover usually start within 4 to 12 hours after excessing of alcohol consumption or a significant reduction in alcohol intake and last from 2 to 7 days. Withdrawal symptoms such as anxiety, insomnia, and irritability, which occur after prolonged intake of higher doses of alcohol, can persist for several weeks after discontinuation of alcohol. In some rare situations, alcohol withdrawal syndrome can progress to severe delirium and life-threatening intoxication, delirium tremens. Patients with varying degrees of addiction after prolonged use of mushroom-based dietary supplements report a significant decrease in the desire to consume alcoholic beverages. Very often, there is a complete refusal to consume alcoholic beverages. This is due to both the physical and psychological impact on the patient who is subject to a threatening health habit. Many patients consume alcohol to escape from the negativity in real life rather than to obtain any pleasure. The psychoactive components contained in the mushroom relieve the patient of seasonal depression, apathy, chronic fatigue, and typical asthenic manifestations. The components included in dietary supplements stimulate the same group of receptors in the brain as alcohol. Therefore, there are fewer reasons to drink. The patient feels great and is always in a good mood without alcohol. Microdosing also helps normalize sleep. A person falls asleep easier and faster and sees brighter and more memorable dreams. This is another factor that allows replacing alcohol for people who consume alcoholic beverages to get rid of insomnia. And a few words about other narcotics. Those who experiment with amphetamines, cocaine, and heroin have a significantly higher risk of dependence. Heroin is considered the most addictive of them. But an individual predisposition to heroin addiction varies greatly. For those who are easily addicted, repeated use over just a few weeks or months can lead to increased tolerance, cravings, and difficulty stopping use. Symptoms worsen fairly quickly with continued use, leading to compulsive daily use of the substance for months or years. In the chronic phase of addiction, the pleasure value of the substance decreases and is replaced by the need to obtain the substance to maintain normal nervous system functioning. This phase of addiction is called physical dependence. In this case, heroin can be replaced by another substance with similar properties, such as morphine, codeine, homemade opium extract, or synthetic narcotic opiates, Subutex, Temgesic, methadone, Tramadol. From the point of view of the addict, the condition is so severe that he or she will acquire either the desired substance, heroin, or some substitute by any means necessary. Proper use of supplements based on mushrooms over a long period of time literally opens a person's eyes to the world, and from a positive perspective. This is especially important for long-term drug addicts who, due to burned-out receptors in the brain, practically do not experience positive emotions from anything except for another dose of the drug. The mushroom will become the basis for excellent substitute therapy, which will accelerate rehabilitation and return the patient to a normal social environment. Fly Agaric microdosing can become the only way to return a person suffering from a certain addiction to a normal way of life. However, it is important to follow simple rules in order not to exacerbate the situation. Fly Agaric should be taken as part of biologically active supplements, in which the correct dosage of active components is carefully calculated. Biologically active supplements should be taken in courses. Therapy should not be abandoned if improvements are not noticeable in the first few days. It is important to adhere to the recommended intake schedule. The course of microdosing removes manifestations of depression with a long fixation of a positive state and inner calmness, which helps to cope with addictions and helps a person start a new life without harmful habits. The patient improves relationships with relatives, finds new friends, and begins to set easily achievable goals for themselves. Thanks for watching, hope the information is helpful.